On this next slide, we can see a study that came out fairly recently looking at the distribution of interstitial lung disease by age of onset. This study included over 300 patients, and you can see in the diagram by age the relative prevalence of these different disease conditions. You'll note that as patients age, the likelihood of this being IPF gets higher. IPF is a disease of the elderly, and you can also see from this particular study that the number of patients with unclassifiable disease also increases as they get older. Now, practice habits differ in different institutions, and my bent and bias is if a patient is more elderly in the context of unclassifiable, there's a good chance that these patients have IPF because it is a disease of the elderly. So some of these unclassifiable patients in this particular study might indeed have had IPF. What about interstitial lung disease complicating the various connective tissue disorders? This can be a source of significant morbidity and mortality. The estimates of the number of deaths in the US from CTD-ILD is about 1,600 annually. This might be more. This data is a little bit dated. And about 25% of all ILD deaths are attributable to an underlying connective tissue disease. In terms of the relative prevalence amongst the different diseases, rheumatoid arthritis, estimated 15 to 20%, polymyositis, dermatomyositis, around the same range, 5 to 20%, SLE, lupus, a little bit less, 5 to 18%, scleroderma, very common, 50 to 70%, and lastly, Sjogren's, around 5 to 40%. So a wide range in terms of how these diseases might be complicated by underlying CTD, by underlying ILD rather.